going to bring
There
Ernie.
we are.
Ernie. Okay. So those two are in now. Okay.
98 people there now.
98 people on
Is that
Facebook.
what that means, live? 98
Let's
people.
go.
Good morning. Welcome everyone to the First Coast Black Nurses webinar series. We are so excited to have you here with us this morning. We're going to start off with mental health in older adults and children. Our second webinar series will be on mental health of the healthcare professionals. I want to start by saying thank you to our sponsor this morning, Dedicated Medical Senior Medical Center. Dedicated Medical is a family-owned operation, and they mainly deal with primary and specialty care practices committed to delivering superior care to Medicare-eligible seniors. So thank you, because this event would not be possible without Dedicated Medical, Senior Medical. I want to start this morning by introducing our guests. We have two esteemed licensed mental health counselors that's going to be with us today. And I want to tell you a little bit about them. The very first person would be Charisma. Charisma Nicholas is a licensed professional counselor in the state of Texas and a licensed mental health counselor in the state of Florida. She's a certified addiction therapist and a certified clinical trauma therapist trained to treat veterans and individuals with complex traumas. She completed her undergraduate degree from the University of North Florida and her graduate degree from Nova Southeastern University. She has worked as a licensed clinical psychotherapist for more than 9 years. And in that time, she has helped many individuals move past their struggles and couples rediscover the joy in their relationship. Charisma believes that healing requires a collaborative effort, which is what inspired her to open up a private practice 2 years ago to empower others to find healing and encounter compassion. Charisma is also a published author of a book entitled 21 Tears of a Phoenix, written to normalize the basic human emotion. Charisma understands how difficult it can seem to manage your life when it feels like you have become isolated, and is here to remind others that pain does not last. Our second speaker for today is none other than Yasha Portier. As a Jacksonville native, Yasha Portier is grateful to be a part of the healing community of Jacksonville. She graduated from the University of North Florida with a Bachelor of Science degree in psychology and a Master of Science degree in clinical mental health counseling. Yasha is a licensed mental health counselor and has provided over 9 years of mental health counseling services and holistic care to individuals who deals with trauma, substance abuse, depression, anxiety, self-esteem, as well as health concerns. Yasha has experience with working with diverse populations, including adults and children. As a licensed psychotherapist, Yasha has a deep understanding of human needs. Yasha is passionate about teaching people how to take better care of themselves, which allow them to love themselves. Yasha is an advocate for self-care and generational healing. When working with Yasha, she challenges you to be your best self. And she wants ongoing feedback that is transparent and direct, but yet empathetic. And I just would like to say thank you, thank you, thank you for being a part of our mental health and kicking it off today. I just can't say thank you enough. At this point, we are going to go to a video. And after that, I want you guys to sit back, relax, and enjoy the dialogue of Miss Nicholas and Miss Portier. Thank you.
About to commit suicide. I'm hearing things, I'm seeing things. Help me. I can't live like this no more.
Cindy Arroyo is a nurse in Texas. She also has bipolar disorder. Last March, she found herself in the middle of a psychotic break. With the virus spreading and the state scrambling to respond, she couldn't get the care she needed. How many phone calls do you think you made?
About 30. They kept on injecting my medication without seeing me. As a nurse, you have to see your patient to know what's going on. And they're like, oh, take your pills and come back next 2 months. Well, in 2 months, I'm not going to be here because I'm going to either commit suicide or take all my pills and go to sleep. That's my 2 options.
That's how you were done.
Yes.
Before long, Arroyo was in the ER after a failed suicide attempt. Within weeks after that, she was in jail following a domestic dispute. It took a stay at a local hospital and months of treatment for her to begin to recover. How do you think things would have played out differently if you would have gotten help sooner?
I think I wouldn't have any lost time. I felt like I lost a year of my life.
In years past, 1 in 5 Americans suffer with mental illness. But the anxiety and isolation of living through a pandemic has the CDC worried that number can now rise as high as 1 in 2. Even as mental illness increases, beds, doctors, and funds previously dedicated to behavioral health has been put towards fighting COVID-19.
Right, this is one of our rooms. As you can see, the rooms are pretty sparse for safety reasons, really. People that finally do end up here are in much more of a higher level crisis because we are only seeing the most distressed people, and then we know there's a lot of people that just aren't reaching out for help.
Dr. Karina Keenan heads up the psychiatric department at Houston Methodist Hospital. This floor used to provide inpatient beds for up to 34 people, but physical distancing turned that capacity in half.
Now, we have a mental health crisis right now. Oh, no, yeah. I think whenever you have something as significant as serious suicidal thoughts doubling within months, and it was already getting to a point where we're really concerned. This is absolutely a crisis period of time.
If things don't change, can you paint a picture of how bad it can get?
I really try not to think about that too often because when you think about how bad things can get or the moments when the system's getting to that point of getting overwhelmed, there starts to be widespread suffering and people start to die. My big fear is that if some things are done, there won't be anyone who doesn't know somebody that's ended their life.
Across the U.S., even before COVID-19, half of all Americans needing help couldn't get any. But in 2020, access to mental health care in Texas was the worst of all states. Sheriff Dennis Wilson works in the rural county of Limestone, where like many places, law enforcement are the first people called in for a mental health emergency.
That's the big broadcast is to put out all our units here in Limestone County. That's the spirit of suspect is suicide.
How many psychiatrists or social workers do you have in this town?
We have 0 psychiatrists and our social workers. Overall, planted out across the federal secretary.
There's been an uptick in crisis calls, something Wilson believes is tied to the pandemic.
There's a lot of people that are suffering now because of their economic conditions and because of everyday strains of life.
If you had to estimate, what percentage of calls do you guys get that are mental health related?
I would say on average between 30 and 35%, and you can trace back to an EMDR diagnosis of a person that we're dealing with that has a mental health or substance abuse issue.
That's a high number.
It really is.
Do you feel like it's your responsibility to make sure that the deputies are trained trained to respond to mental health crises like that?
That is our responsibility of our job, and that's part of the oath of office that we take, is to protect everyone. I do not control the checkbook nor does any other police administrator. That has to come from your, provide the necessary funds that allows you to have that expertise and training. Hey.
Are you worried that since there's so few options for treatment in this county that once COVID-19 ends, people will still suffer from those long-term mental effects?
Oh, sure, there's no question about that. There's still going to be a huge need for mental health services. The person that is in Texas, it takes about 8 times longer for them to get through the criminal justice system than the person that does not suffer from mental health illness. We have a large number of inmates that in the county jail in Texas, and that number yesterday was close to 4 inmates that have been court ordered by a district judge to receive such services that are on a wait list, or sometimes it can be as long as a year before they get to that same hospital. But I certainly disagree with that.
At this point, we're going to have a dialogue.
Yes. Thank you, Dr. Neal. All right, good morning, everyone. Again, my name is Charisma, and before we even begin, I want to thank everyone for taking the time to be here with us this morning. And before we go even any further, we're going to be talking about some heavy topics this morning. So I'm going to ask everyone to go ahead and give me a deep breath in and a deep breath out. And although we can't see you, I'm going to trust that you are taking a deep breath in, because the first word that we all heard throughout that video was the word suicide. I did not want to live anymore. That is the impact that COVID-19 has had on the overall mental health of individuals. I did not want to live anymore. So go ahead and give me a deep breath in, because there's someone watching this video that was triggered by that comment. And as a psychotherapist, I know that. So let's honor our own feelings. So as we go further, what an honor it is to be on this call. Thank you, Dr. Neal, for inviting us. Right, so as we go further, let's go ahead and operationally define what it is when we are talking about the older adult population and when we are talking about children. When we are speaking about older adult population, we are speaking about those that are at the age of 56 and above. And when we're speaking about children, we are speaking about those that are under the age of 18. It is very important that we clearly define the age. So again, older adult population are those that are 56 and older, and children under the age of 18. All right, so before I hand it over to Ms. Yasha, when we are speaking about the impact that COVID-19 has had on the mental health of the older adult population, let's go ahead and point out a few factors: isolation, feelings of loneliness, the lack of autonomy, the autonomy being taken away. Those are factors right there. And also, again, the lack of motivation. I don't want to go on. Lack of support system. The adjusting to the new normal, having to adjust. And then also, can we all go ahead and point out virtual appointments now? Having to adjust from going in, from having to take away, from going into seeing your doctor, as we saw in the video, going into seeing your doctor appointments, and now having to adjust to virtual appointments. Now we have to expect older adult population, those that are 56 and older, now to adjust to virtual appointments. So Yasha, can you please highlight some other factors and take us a little deeper, peeling the onion back for us, right? Because we're not sugarcoating this webinar this morning, right? So peeling onion back. Take me a little deeper, and how loneliness, autonomy, virtual appointments, having to adjust has affected mental health for those that are 56 and older.
Yes. So I just want to say, collectively, as a human race all around the world, we have all been impacted by the pandemic. one thing that we all already have in common is that if you was to prick us, we will all bleed the color red. But now we have all experienced the pandemic. We have all been experiencing it in different ways. So we want to honor that. But specifically this morning with the older adult population and children, we're going to highlight a few things. And as Charisma said, we're going to go deeper. And so what we ask of you today is when we speak about older adults and when we speak about children, to really try to place yourself in the shoes of an older adult and what it's like for them. And place yourself in the shoes of a child and imagine what it can possibly be like for them as well. Yes. Yes, yes, yes. So collectively, we are in this together. So speaking about the older adult population, ages 56 and older. So naturally, as we age, there are some things that we're naturally going to be worried about, right? Things are slowing down for us. Eyesight, movement. We have to get used to that, right? The loss of our autonomy and independence, where we just can't, jump up and do things on our own, like we was before. We're worried about our finances, having our retirement in place, making sure everything is ironed out. Also, as we get age, we're losing individuals, right? We're losing our loved ones, our friends from high school, our neighbors. So thoughts of loneliness or just being alone is already there. With experiencing the pandemic out of nowhere, imagine that those worries, all those concerns are going up. For the older adult population, the mental health diagnoses that are already prevalent are depression, anxiety, dementia. So those are some of the mental health diagnoses that we are already kind of seeing with the older adult population. So imagine how the pandemic and COVID is impacting that. Mental health is the emotional, psychological, and social well-being of an individual. It impacts how we feel, how we think, how we act, how we cope with stress, how we show up for ourselves, and how we show up for our job and people in our lives. Yes. And so imagine as an older adult with already, having some of those natural concerns that I just spoke about, having to now with loneliness that has increased. Research within this past year, research has already shown that the level and feelings of loneliness are way more prevalent now with the older adult population. Loneliness due to social distancing. And we all know that certain rules have been in place because to keep us safe, there are certain rules that the assisted living facilities have had to put in place. Nursing homes, different community living has had to put in place in order to keep everyone safe. Because with the older adult population, we have witnessed and research has also said that they are more susceptible to contracting the virus. So the rules have to be in place.
So Yasha, let me ask you, if research says that older adult population are more susceptible to contracting this virus, doesn't that also suggest that there's an underlying fear of what? What is the core belief underlying fear? Aren't you also hitting on the double D's here, death and dying?
Yeah. Am I next? Am I next to contracting the virus? Am I next to getting a phone call and saying that another loved one has been lost or another friend has been lost? And so that increase of loneliness has increased. The fear of isolation has increased. And not only the rules that have been in place with the facilities that in order to keep us safe, but older adults for themselves thinking that, okay, I don't want to go outside. I don't want to go to the grocery store. I don't want to even go outside of my apartment because inside is where I'm most safe for contracting the virus. But you're also left with your thoughts, just reoccurring thoughts of, am I next? The fear of death and dying, right? And like I said, remember, before the pandemic, there are already natural worries that are occurring for the older adult population. And so now to have that increase, that's going to impact your mental health. And then we look at, okay, feelings of hopelessness, feelings of sadness, anxiety, feeling anxious, which is impacting how you sleep, how your appetite, getting the food and nutrition that you need. When you're dealing with depression and anxiety, there's a high impact on your appetite and your sleep hygiene. And so we're seeing this in the older adult population once again, being alone and being afraid to even talk about it, with their loved ones.
And you feel immobilized. You literally feel
Yeah.
paralyzed. Because
Mhm.
oftentimes we all know that there's a stigma with mental health, that because you can't see it, that it's not there. That
Mm.
you feel depressed. Well, oftentimes we may hear things like, well, just go sleep, it's all, or go pray about it. Or maybe, you're not going through anything, but it is real that although it is not an open wound that you can actually see, that depression, anxiety is real because it is of the brain, right? So what we are seeing is that COVID-19 has perpetuated what is going on internally, and how we are seeing it manifest externally is the lack of motivation to want to go anywhere, the lack of motivation to get out of bed, the lack of motivation to want to eat, to want to do our hair, for women to want to do our hair, to want to get out of bed. And it's not to say going to the hair salons or anything like that, but the willingness to want to engage in self-care. Right?
Yeah.
And when the lack of self-care loses, what are we transitioning into? The lack of self-esteem.
Yeah. Yeah.
That's
Yeah.
what we are transitioning into. And
Definitely.
we have seen that. And with anxiety, because this is what I'm experiencing with my patients, with anxiety actually can mimic symptoms of a heart attack. So what we are seeing is that when clients do not actually understand their symptoms, and all they're seeing is that, because with anxiety, some of the symptoms can be racing thoughts, restlessness, feeling as if your heart is beating extremely fast. So when clients don't, especially older adult populations, don't understand what is going on, what do? Rush to the hospital, feeling as if, I think I'm having a heart attack. And then the doctors medical staff perform this test and says, sir or ma'am, your heart is fine. Your heart is fine. So then what happens to the patient? What do you mean my heart is fine? This is what I'm feeling. This is what I'm feeling.
Yeah. Yeah.
Now, Yasha, what do we say to the patient when the medical staff comes back and says, sir, ma'am, I have run all the tests. Your heart is fine. And they're still struggling with, but my mind is all over the place. I'm scared to go outside. I have no support. I'm home, virtual appointments. I need help.
Yes. Yeah. I encourage clinicians, doctors, mental health counselors, social workers, anyone that is in the work of the health field that have direct contact with anyone, but specifically the older adult population, to include mind and body practices in your work. So after your session and your assessment, and when I say mind body practices, I mean with a focus on intentional self-care, a focus on compassion. That's going to give the older adult that empowerment that they need to know that they have control. There are some things that they can be doing at home
Yes.
within their own space to keep them safe and let them know that they have control over their health, whether it's being intentional about the foods that they eat, meditation, journaling, online support groups, mild stretching, a walk in the morning before everyone gets out with their day, early in the morning walks, or a walks that they can do with a friend that's safe, that's along with the safe practices of COVID. So include the mind and body practices within your work when coming to the older adult population. This is going to allow them to feel empowered and to continue cultivating their self-esteem. Those little things like Charisma was speaking about when it comes to being able to go to the hairstylist like you used to, or just go to the grocery store like you used to on your own.
You
Those are the things
experience
that
self-care.
those are the things that as an older adult you enjoy. You enjoy those little things, being able to get out and do those things on your own. So remember, when now that they're not don't have those things readily available to them, they can't go and get their hair styled or go get their hair cut or just go get their groceries or go to church even like they were able to, that those things are impacting them. But empowering them within your practices and work with the older adult is going to help empower them and increase their self-esteem, because there's so many worries that they're having, right? Like we were saying earlier, worry about their finances. What I'm seeing in my work with my clients in my practice is being, laid off. Not they wasn't quite ready for retirement. That's not, they wanted to continue to work, but due to the impact of COVID and how it has impacted the workforce, being laid off. So now that is added worry. How am I going to be able to provide for myself? How am I going to be able to sustain my bills? And once again, when you are growing up of age, you're already losing a lot of ones. So there's not many people too that you feel like you have the support of. And so that's something to be mindful of. And so when we think about our family, friends, neighbors, we all know someone, right? Whether they are a neighbor, a church member, or within our own families that is of the older adult population. Maybe you've thought about some of these things, maybe you haven't, but there are things that we can do as a community, as a family member, to help support the older adult, right? Like Charisma mentioned earlier, this use of heightened use of technology and going into the Zoom calls and the tablets and logging on and clicking the link, that also can increase worry and stress as well. And those are the very things that will help an older adult feel like they're a part of the celebration and that they are included. So there are things that we can do. For example, we can, come over to our older adults, family members' house, and walk them through the how to dos, right? How to log onto a Zoom call, download the app for them, maybe write a brief little note where they can sit next to their nightstand or up on their refrigerator with some brief steps that they can take to get on the Zoom call. When you are celebrating things in your life, whether it's the little or big things, give them a call and let them experience it with you. Walk them through the house tour, the new house that you just purchased or the apartment that you just leased out. Walk them through it. Allow them to feel like they are a part of the little things. Let their nieces and nephews, their grandchildren, call them after school just to say hi, to give them good news about their report card or how their day was. Let them read stories to the young ones in the family through the Zoom call or the FaceTime call. Walk them through the steps of how to do their telehealth and telemedicine appointments. Us younger younger population, we know these things. We know how to go about it. We have more access on how to, go to Google and look something up really quick. That's one thing that we have, and we can extend that compassion to the older adult population, making them feel that they're not alone, letting them know that they are not alone, that we are all in here, all in this together, even though we all have experienced the impact of the pandemic and the stress that has come along with it. There are things that we can do as a community to help the older adults feel more empowered and to help them along the way when it comes to their mental health. Mhm.
And Yasha, I love how you are highlighting the word community. And why I love that you are highlighting the word community is because although the main point of the social distancing was for safety, it also did what? Created separation. And with
Yes.
creating separation, it created space for loneliness, for inviting feelings of loneliness. That separation invited feelings of sadness, right?
Mhm.
Many of us lost connections with our friends and families. So
Mhm.
we do need community. And life was not meant to do alone. So
Mhm.
this pandemic stole from us. And I'm purposely using that word stole, right? This pandemic stole from us so many of the way we would typically celebrate
Mhm.
holidays, celebration, graduations. And yes, I love how we have transitioned into celebrating these celebrations and holidays and achievements virtually. However, if we're being completely transparent, we want to celebrate with our loved ones in person and hug and touch them and be around them. And last year with this pandemic, we our we were forced, yes, I'm going to use that word, forced
Mhm.
to celebrate baby showers and graduations virtually. And that was a big adjustment for the older population because if they were scared to leave their home because they were not invited or they were not a part of. And what did that do, Yasha? What did it what does that do for someone if they were not invited or they were not a part of? What does that do for someone, especially for the
Yeah.
older population?
Mhm.
That
Mhm.
creates what?
It's going to feed into the thoughts that they're already having, the reoccurring thoughts that they're already having, that they are feeling isolated and feeling alone,
They don't
and that
belong.
yeah, and feeling invisible, feeling not only the recurrent thought of am I next, but do I matter? Has my family forgot about me? Using so those questions that are reoccurring really really can have a negative impact on one's mental health. And so when it comes to the older adult, right, there are some things that you can do for yourself, right?
Yeah.
Let's take a look at our self-care, intentional self-care, and that all that means is to meet your needs at any given time. So if you need to take a break from the social media and the news. Some of my family members I know and my clients, they literally have the news playing all day long in their homes, and they're saying the same things, they're repeating the same things, but how that can be impacting your mental health is that it's increasing your worry, it's increasing your stress levels, and causing you to feel even more anxious and in a panic regarding the outcomes of what's going on in the world regarding the pandemic. And like I said, they're repeating some of the same information. So at all times, is the all that information that they're repeating, is it helpful for you? So I suggest pick a time where you either, look at the news for 30 minutes in the morning and then 30 minutes in the evening, not right before bedtime, but during the evening, maybe after or before dinner, you watch 30 minutes of a segment and let that be it. Because when we continue to digest that information and all those scares, that our body, our nervous system is digesting that. It's digesting that. Even if on a conscious level we're feeling like we're not worried about it, our nervous system is being impacted about the uproar and the anxieties that are being projected out of the television or social media. So that's one way you can meet your needs. Set those boundaries with yourself, whereas you pick a time to digest all this information. Another way that you can go about meeting your needs and being intentional about your self-care is being mindful of your nutrition and to the best of your ability. And I want to say, I know that you all are doing the best that you can. But be mindful of your nutrition, things that you intake, eat more along the lines, nutritious foods. Be mindful of your sleep regimen, and try your best to get between 7 to 8 hours of sleep to the best of your ability. Be mindful of when your family members are trying to reach out to you. You know, if you feel frustrated with how to log on to the Zoom or log on to the video call, talk to them about it and let them know that you need help. It's okay. We're all in this together, and it's okay if you need help. We all need help at one point in a time. So don't be afraid to ask for help. Be mindful of the nutrition and your sleep hygiene, and also be mindful of your physical activity. And with being isolated, there's a lot when we're seeing that the older adult population is just sitting at home. If you can get out in your garden or get out in your yard, or if you can just go sit out on your porch and get some sun and just be mindful and sit and be with nature, that's another thing that you can do as well. And I ask our community, the family members and friends of older adults to listen. We don't always have to have the answers when going over to just to be with our family members. One thing that we can do is just listen. If they are feeling lonely or if they are expressing their fears, just listen to them. They need to get it out. They need to be able to talk about these things. And maybe you may have some guidance for them, but if you don't, that's okay too. Just listen. That's going to allow them to know that they are supported, they are seen, they are heard, and you are doing amazing thing, and you're helping. If you don't even know, you're helping their mental health status. You're helping them. So they know that they are not alone in this.
Thank you, Yasha. So we just went over, and for the sake of time, we couldn't go into really, really deep, and because there's so much other factors on how COVID has significantly impacted mental health for the older adult population. And Yasha, thank you for taking us deeper into how you've seen and how you've experienced the underlying factors, right? However, let's transition into how we have seen children and how their mental health has been impacted, right?
Yes.
So before we even get into how the mental health of children has been impacted, I always like to start with the visualization. And Yasha, you already know where I'm going with this, right? Because I always like to begin with the bus scenario and the first day of school. So Yasha, do you remember your first day of school? Let's go back to maybe 6th, 7th grade, right? We're talking secondary school here, right? Or like maybe in primary school. So we're talking 6th, 7th grade. So I'll be honest, and Mom, Dad, if you're watching, I apologize because the truth comes out now. The first day of school, I'll be transparent, I was not excited to necessarily go and sit in a classroom to learn. The first day of school for me, I was excited to see who was going to be in my class,
Mhm.
show off my outfits, right? That I stayed up maybe 2-3 days prior picking out.
Mhm.
First day of school was anxious. It was exciting. It was maybe if I was walking to the bus stop. The first day of school for children is that it's looking forward to who is in my class, who am I meeting, who is going to be my teacher, what's outfits am I wearing, what's the new styles, what's the new shoes coming out. And then here comes 2020, and here comes the invasion, purposely using these heavy words, right? Invasion of COVID-19. And children are forced to adapt to virtual school. So here we come, where that excitement of the first day has been stolen. So the question is, if school for children was their safe space, because perhaps for most children, their home was not their safe space because perhaps, let's say, mommy and daddy, or maybe mom or dad were abusive, and school was their safe space. Now we took away schools. Now we're seeing the increase of abuse in our homes because last year the numbers doubled. Last year, the numbers for domestic violence doubled. Why? Because now we're seeing with the projections taken out onto children. So the safe space for school was taken away. And children were where? Home with their abusers, with their perpetrators.
Mhm. Yeah. Yeah.
So how is
Yeah.
mental health impacted? Well, of course, we are seeing suicide not only in the older adult population, guys. Guess where we are seeing suicide? Also in children. And suicide also significantly increased because the amount of children that I have worked with, and again, when we're speaking with children, speaking about children, speaking those who are under the age of 18. So I have also seen children who have sat in front of me saying, I no longer want to live. Why? I just feel alone. I can't see my friends anymore. I miss going to school. It's weird seeing my teacher on the screen. I can't learn the same. I'm failing my classes. These are the statements that I'm hearing. So how is the mental health impacted? Now we are seeing poor work, a school performance, decline. Now we're seeing increase in depression, lower self-esteem. For females, we are seeing increase in promiscuity, increase in self-mutilating behaviors as evidenced by cutting. For males, we are seeing increase in rebellious behaviors, maybe an increase in substance use. So again, if school was once their safe space, where do they have to go? Now, let's say that if they were experiencing bullying in school, because that also happens as well. So, Yasha, if children were experiencing bullying in school, what are some other ways that their mental health could have been impacted if, let's say, that their home was indeed their safe space? Because not all the time, we're not saying that their homes are not their safe space, right? That is not the case for all children. So if their home was indeed their safe space, what are some other ways that mental health for children has been impacted?
Yes. And so now, being at home, and now, their safe space is now their joy being at home because they were being bullied at school. It doesn't mean that the bullying went away. The use of technology has also risen. And so we are seeing a increase in online bullying, an increase in the all these different group chats and different apps. I only know Instagram and Facebook and a little bit maybe TikTok, but there's different challenges and more bullying that has increased online. And so the bullying didn't go away. And so maybe they're really enjoying being at home, but they are afraid to even talk about the bullying with their parents. Their
Why might
parents
they be
are
afraid?
their parents are, they have increased worry as well. They're trying to navigate through their work and doing the online at home work and being the assistant teacher for their children when it comes to the online schooling. And so there's a lot that the parent has had to deal with as well. And so I ask, when you notice these different behaviors kind of change, or you notice a change in your child, all the different changes that Charisma was speaking about, with just you notice that they are isolating more, they're not enjoying the activities that they used to enjoy, that you are noticing that there's just some suspicious behavior going on, to not ridicule them or judge them, but to get curious. And to ask them, you are their safe space. As adults, we are responsible not only for the physical environment to be their safe space, whether it's home or school. We have to be their safe space. And so make it comfortable enough for them to be able to come and speak with you and talk with you, and get curious and ask questions. Don't be afraid to ask. Children are brilliant. They are brilliant. They are so talented and gifted. And if you ask them and they feel emotionally safe with you, they will talk to you. They will talk to you and ask them how they feel. How are they feeling regarding all these changes with COVID? There's a lot of grief that's going on the inside, and we can't minimize that.
Thank you. And Yasha, this is why I just knew that this morning was going to be so powerful, because there are two key points that I just knew that I was not going to leave this morning presentation without saying, even if we went over, without saying, and that was grief, and then a great learning tool for parents and loved ones this morning, and that was the word grieving. Because oftentimes, a lot of people think that the word grieving is often monolithic with if someone passes away. And grieving, let me go ahead and clear this up. Grieving is the loss of someone or something of significance to you. I'll go ahead and repeat that again. Grieving, or to grieve, is to grieve something or someone that was of significance to you. That could be someone, a car, loss of self, a job, a house, a pet, and also for children, school.
Not only school, but all the events, right?
Going graduation, because I love how we are. I'll be honest, I love the virtual graduations. However, I'll be honest, because I'm hearing this from children's mouth, they are missing graduations, the way it was celebrated, because it's a celebration, it's a joy to accomplish that you are graduating, whether it's 7th grade, 8th grade, 9th grade, 10th grade, it's an accomplishment, right?
Yeah.
They're also what about birthday parties, Yasha? What about
birthday parties, dances,
together?
Sports events that take place. And remember, at the beginning of this presentation, I asked everyone to really put yourself in the shoes of a child. When you think about your graduation, that you were so excited, to throw the hats off, to laugh, to celebrate, to be able to go out to eat. And children, they see that, they watch that, they know what to possibly expect at graduation. But to have that taken away, we as adults cannot underestimate the grief and loss process that Charisma was speaking about. And some of those signs and symptoms of grief is going to look like sadness, anger, guilt. Yes. Definitely.
How do these symptoms, how do these stages, Yasha, manifest for children? Because they do not manifest the same way as adults, right? Because children can conceptualize the same way as adults. So how do these stages manifest in children. Because depression as an adult may look like, for me, not wanting to get out of bed, but I'm an
Yeah.
adult. But how would depression show up as a
Mhm.
child?
Usually with acting out or attention seeking behaviors. And so when you see that, it's going to be important for you once again to get curious. Okay, this is different for my child, or this is different for the child that I'm watching in any arena where you're dealing with children. Getting curious and noticing the behavioral changes that are taking place and that are happening. And also, we have to be mindful during childhood and adolescent years. Those are some of the most critical years when it comes to brain development, when their brain is still developing. And so to, already, be dealing with the natural, stressors and anxieties that come with being a child, and the time of self-discovery, having to undergo all of these things during the pandemic is a lot. So we can't just, sweep it underneath the rug, as Charisma would say. We can't just sweep it under the rug.
Because what's swept under the rug stays in the house, right?
Yes. Yes.
So I'll say it again. What is swept under the rug stays in the house. So the symptoms that shows up in the older adult population will not manifest the same way as children. So a child will not necessarily come to you and say, they actually may. So let me go back and say that again. Not all children will come to you and say, hey, I'm feeling sad today. They may come and say, I don't feel like doing that. They may rebel. So don't shut down and come back. Get curious. Why? What changed? What's going on? Another acronym I want to actually teach you all today. We all know the word slur. And the word slur can have a very negative connotation towards it, right? So I'm going to go ahead and use the word reframing to reframe the word slur in a positive way. And this is a really good tool to use when working with children, and you can actually use it when working with anyone. And what slur stands for is support, listen, encourage, and reflect. You use that in the 4 steps when approaching anyone you want to get curious about. You support, you listen, you actively listen. Oftentimes, you listen to respond and not to actually listen, right? We listen to just have a response. So you want to use the slur tool. You want to support. Take the time aside to Jane Doe. So yesterday, usually you come home and you say good evening, but yesterday you went straight to your room. So I want to take the time to actually listen to you. Encourage them. I understand that it was a rough day. And you want to reflect. What reflect means is, so I heard you say that it was a rough day. How can I support? So oftentimes, because I remember this growing up, and being from Caribbean culture, and I remember growing up and coming to your parents and telling them like, man, I had a rough day today. What do you know about a rough day? So oftentimes you get to I'm kind of get those dismissive comments, and let me tell you, as a psychotherapist, those dismissive comments to a child is actually not healthy, because what it does to a child, it shuts them down mentally. And on a cognitive level, when you do that to a child, what they grow up seeing and doing, they actually continue those behaviors. So they learn that their emotions are not safe to express. That's what you're teaching them when you say, what do you know about a bad day? Because we have to honor that their child. That rough day for them in 7th and 8th grade and 9th grade was a rough day for them.
Yes.
And as adults, our rough day paying bills and what we're doing, that's a rough day for us. However, remember that we were once children too. We were not always adults. We were not always professionals and working individuals. We were once 10 years old, and we were once 10 years old, frustrated, had a crush on someone, and stressed out. Right? We forget that because we get older and then life hits us. We forget that we were 12 years old, stressed about a teacher's test that we did not pass. We forget.
Mhm.
So when you're working with children, remember the slur model: support, listen, encourage, and reflect back.
Mhm.
Josh, any comments you had
Mhm.
on children that I did not touch on?
Yes. I just want to highlight that acronym that you utilize, not only with children, but with the older adults as well, with anyone that we can just listen and actually hear them, actively listen, as opposed to feeling like we always have to have some sort of response. And that is so critical for children, like Charisma was speaking about, because that teaches them a lot. It teaches them a lot on a subconscious level, that their feelings, their emotions, they're not important, they don't matter, and they internalize that. And what children need, what we all need, but what it starts off during childhood, is we need to feel safe,
Yes. Yes.
seen,
Yes.
and heard. And as adults, that's our responsibility to do so. And so, Charisma, it takes a village, right? It
It,
takes a village.
it does. I do remember the old adage that's, oh, it did come to me. The old adage, I believe that it says that it takes a village to raise a child. And remember, the old adage does not say that you need a child or you need to have 10 children. It simply says it takes a village to raise a child.
Mm,
So the question that I'm posing without a response right now, simply answer to yourself. If the old adage says that it takes a village to raise a child, how can we, demonstrating community and unity, to combat the separation that this pandemic has caused, how can we demonstrate that village and be that village today for our children?
mm,
How can we support our children today? Whether that's even if we're in a grocery store and we see a parent struggling, how can we be that village and support?
mm. Yeah.
Again, how we combat separation is with unity.
Hmm. Yes.
So, wherever you are, go ahead and answer that question just to yourself. How can you be that village within yourself?
Yeah. Yes. How
So,
can you be that village for children, for older adults, for us all? Yes, we all have a role or something that we can do. Yes. So we're going to get into an exercise, right, Charisma?
yes, I'm actually very excited about. And this is a powerful exercise, actually. And what this exercise is called is let's call it a guided meditation exercise. And it's called the MIA exercise. And I'm going to ask everyone, wherever you are, if you feel comfortable, you can close your eyes. If you don't, you can leave your eyes, you can keep your eyes open, totally up to you. And the only instructions for this exercise is that I'm going to ask you to go ahead and place one hand over your heart like so, and the other hand over your rib cage, like so. Simply like so. And what this does is bring connection with your inner self. So again, if you feel comfortable, you can close your eyes. And if you don't, that's okay. Leave your eyes open. You deserve to make choices in your life. Again, with this exercise, we are only going to ask and say 3 statements. If these statements resonate with you, simply say, me too. If these statements do not resonate with you, remain silent. Again, if these statements resonate with you, simply say, me too. If these statements do not resonate with you, that's okay. Just go ahead and remain silent. Go ahead and take a deep breath in wherever you are sitting and release. Again, give me one deep breath in and release. And now Yasha will begin.
Okay, let's begin. If you feel comfortable, close your eyes. Now, place one hand over your heart and the other hand over your rib cage. Take a few deep breaths. Inhale and exhale. Again, inhale and exhale. One more time. Inhale and exhale. I'm going to ask you a few questions. As I ask you these questions, if you can relate, say me too. Not yes, but simply the words me too. If it does not resonate, remain silent. In the past year, did you ever think you were next? Next to contract the virus, next to hearing awful news, or next to experience a loss? If this resonates, say, me too. When it comes to feelings of loneliness this past year, did you feel the emotion of loneliness more often than usual? If this resonates, say, me too. When you think about your ability to navigate through change this past year, did you experience an overwhelming amount of exhaustion? If this resonates, say, me too. Many of us in this room and collectively are saying, me too, as we reflect on this past year. Experiencing a pandemic can be emotionally, physically, and mentally exhausting on us all. We have the inner power to extend compassion and joy to ourselves, to others, our family, friends, and neighbors. I ask that you keep your hand over your heart and rib cage. I want you to affirm these words within yourself. I trust
In
the knowledge that I am safe and in good health. The worries that surrounded me before have no power over me. I stand reassured what may seem against me will always work out for me. Take a few more releasing breaths. Inhale and exhale. And when you are ready, you can open your eyes. Yeah.
I want to take the time to honor every individual on this platform this morning. Again, as I said previously when we started this webinar, you could have chosen to spend this hour anywhere, and instead you chose to spend it here. And I honor you, and it's always a pleasure. So thank you. Thank you.
Yes.
And before we hand over to Dr. Neal for Dr. Neal to do her question and response, I want to also thank you, Dr. Neal, for the opportunity to come on here this morning and to just present and talk. And I really honor
Yes.
the opportunity. So thank you.
Yes.
Thank you. Thank you to
Thank
both
you.
of you. It was enlightening. I actually learned a great deal, and I'm sure our audience has well. I was just notified we have well over 100 people on Facebook Live watching us right now. So I'm sure all of those individuals are watching and learning. So I enjoyed the dialogue, and the exercise was very different. I love it. I only have a few questions because you guys touched on everything I could possibly think of. But one of the questions that comes to mind are veterans. How are we dealing with What about veterans with mental health? A lot of times they come back home and they're just not the same because they're dealing with post-traumatic stress disorder. And I can't even imagine what veterans are going through now with COVID-19. Could you guys respond? One of you guys answer that question. What are we dealing? How are veterans dealing with this?
Yes. So,
So, that's a very great question. Hi, Yasha.
Yes. To briefly touch on it, in my practice, the majority of my clients are veterans, and so most of their diagnosis is PTSD, and so it's complex PTSD, and so there are different things where there is anxiety, nightmares, hypervigilance, being on guard, that their body is constantly in that fight or flight mode. And so what we've seen with the impact of COVID, like we spoke about with children and older adults, all of those symptoms have been heightened. And so in my practice, in my care, and Charisma more than likely can relate, I have really been highlighting self-care, intentional self-care, where we discuss their emotional, mental, psychological, social, occupational, financial, and spiritual self-care. This is allowing my clients to feel empowered, and also teaching them a lot of the tools. I like to call it our coping skills toolbox. And we actually create it together where they know they have the tools at home to be able to cope with all the different stressors. And a lot of these practices include things just like journaling. That we have some of my veterans have their go-to guided meditations that they have learned that really help self-soothe them when they are feeling a heightened of emotions. And so we're also encouraging them to really be mindful once again of their nutrition, and the things that they're intaking, and also the news, not only the news, having those boundaries there with what they intake, but having the boundaries of different movies that they're watching that are triggering to them, whether it's movies about like grief and loss, or movies about a lot of killing or loss of loved ones in a movie, to monitor that and have boundaries with that as well. And so I've really just been highlighting their self-care practices, and I find that really empowers them to know that they have the tools, everything they need on the inside of them. Let's not forget about it. We have all the tools that we've been learning about over the past year, and this is the time to really, really put them to practice.
Thank you. I love it. For the sake of time, I have one last question, and this question would be to Ms. Charisma. Could you talk to us about sexual abuse? How are we dealing with children that are dealing with sexual abuse? What is it? Their mental health with sexual abuse issues. Because like you said, a lot of kids are left home now because of COVID. But what if these kids were sexual abused prior to COVID? So how are we dealing with sexual abuse with children or even young adult? And this could be male or female.
Yes, very, very great question. So as a trauma therapist, when I have a child and they have been sexually abused, how I teach them is trauma therapy. So oftentimes that can be seen through play therapy, right? And creating a safe space for that child. So first you want to make sure that you first are in tune with that child and they know that they are safe with you. Because if they have been sexually abused, they're going to first see you as someone who's going to hurt them. So you first want to make sure that you are first reassuring that child, going back to that SLUR method, support, listen, encourage, and reflect. You want to first make sure that that child sees you as a safe space. Once that is established, the rapport can start to be built. Once that is established, then I go right in and I begin trauma therapy, because you want to make sure that the trauma is healed. Because if the child is not healed, what happens is the adult just becomes the hurt child within.
Mm,
So
that's
you
sad.
want to make sure that the healing does begin. Because
So
oftentimes we have a lot of hurt adults walking around.
So the adults really never, that child, that wounded child is still in that adult, and that affects them as they go on in life.
Definitely.
And that is what we call unresolved trauma. And
Yeah.
that's what we call the inner child, the wounded child. So the child that does not get the healing when they're younger becomes
Right.
the one wounded child living in adult bodies, mimicking adult lives, doing
Yes.
adult things, but they're still the hurt child in women.
Wow.
Yeah.
Wow, thank you. That's a powerful answer. Both of you guys. I just, as president of the First Coast Black Nurses Association, we just would like to say thank you. Thank you so much for taking time out of your day and being our speakers for today. For everyone that is on Facebook Live as well as YouTube Live, we would like to say thank you very much. And we cannot end without thanking our sponsor, Dedicated Senior Medical Center, which has 6 locations all over Jacksonville. Thank you so much for being our sponsor for our series of mental health. Our next
Thank you so
event will
much.
be on May 8th, and we will be talking about the healthcare providers.
Okay.
And because believe it or not, nurses and doctors, they have mental health issues as well. They
Yes.
really do.
Yes. We all do. And I would just like to add that mental health is health. Mental health is health. We speak about physical health and going to your doctor appointments and making sure that your medical appointments are attended to. But mental health is health. Your thoughts and your feelings matter. And we know that resources such as therapy and medication is not readily available to everyone. We want to leave here today knowing that we are community and that we are all in this together. But we also want to know that, let you know, there's things that you can do at home, which is your self-care practices, which is challenging the reoccurring negative thoughts, your deep breathing, just like we demonstrated in the exercise. There's guided meditations on YouTube, on different apps that are readily available to you to help you manage the feelings of anxiety, depression, and anger, grief. There's different practices and different resources out there readily available to you. Okay.
One thing I summed up from both of our speakers, from Ms. Portier, she said self-care. We need to take care of ourselves. And one of the things I gathered from Ms. Charisma, making sure you find a safe place. That safe place could be a person. It could be your prayer closet. Wherever that safe place, find that safe place for you. My safe place, I love walking on the beach. It's something about the salt air is very calming, and listening to my jazz music. So whatever is a safe place for you, find that safe place. So at this point, I would like to say thank you, ladies, for the dialogue. We're going to close our webinar series and wrap this one up and get ready for our next one on March 8th. May 8th. Thank you very much. Have a great rest of your day, everyone.
Thank you.
Bye-bye,
Thank you. It was an
everyone.
honor. Bye.
Nervous.
Oh.